Welcome to episode 6 of the Medical Receptionist Network podcast. I am your host, Shivhon Adkins. Don't forget to grab your copy of the Medical Receptionist Network Handbook for Success, available on Amazon. You can also visit our website at medicalreceptionistnetwork.com. You can have access to the handbooks there, as well as contact us and show any interest in our online training or group training for your office or your coworkers. Today on episode 6, we are joined with guest Cynthia Belovin, who I'm going to call Cindy if you don't mind. Welcome, Cindy.
Thank you. Thank you.
So thank you for joining us. And today, can you just let everyone know where you're from and how long you've been working in healthcare?
I work at Brunswick Hills OBGYN in East Brunswick, New Jersey, and I've been in healthcare for since 2010, so 8 years.
Okay. Now, was that your first position was with Brunswick Hills, or did you start with another healthcare facility?
No, Brunswick Hills was my first healthcare position.
Okay. And what specialty so it's OBGYN. So have you worked in OBGYN throughout your whole career?
Yes.
Okay, great. So what made you become a receptionist?
I was going back to work after taking care of the kids, and I just needed a job, so I applied. Actually, I knew someone that worked there, so they needed help with the front desk. She asked me if I'd be interested, and I did. I was, so I applied, and they hired me, and I was there ever since.
Oh, wonderful, wonderful. So before you became a receptionist, were you in any other industries before you started your family?
Before I started my family, I was I used to do data entry in Manhattan.
Okay.
For a company. Wow. It was called TIAA.
Oh, wonderful. Okay, so you were commuting and everything.
Yes.
Okay.
Yeah.
All right. So did any of your work history there and some of the skills that you needed transfer into your position with Brunswick Hills?
Yes. Yeah, all my data entry, anything, for accuracy, and yes, not as far as medical, but as far as, and anything else went. Working with the computer and all that, phones.
Right, because some of those skills, they definitely stay with you, as we move on, so that's good. And so since you've been in the industry for 8 years, what do you think would be the most influential, like the biggest lesson you've learned, whether it be about customer service or healthcare itself, just being a part of, I didn't mention that we did work together, so I know what you do very well, and I know the certain kind of things that you deal with, but for everyone else, can you just tell them what you've learned that has been most influential in your career, and, what's been very helpful for you to be good at what you're doing and, have this longevity?
Okay. Well, I will say that you were an amazing manager. You were a great person to work with. And, customer service, care. Well, I love to take care of people. I love to see people, happy and, when they come in all stressed and, worried about their appointment. We take care of that before they even get past, the front desk.
Right.
I like to, know my job, know what I'm talking to the people about as far as, like, their procedures or, booking their appointments. And
so being knowledgeable is very important to be able to convey that to the patients and make them feel more comfortable.
Yes. If I can't, if I don't know what I'm talking about, they're not going to feel more comfortable about what's going to, what their appointment is or the procedure is, so yes, I feel like, being able to, speak with them and, just have, a relationship with them.
Right.
From the second they come in, I feel like their appointment is that much better.
Absolutely. And I have to tell you guys, Cindy used to sit at the most active desk, and probably still does, of the front desk, and, taking on, that responsibility. That's kind of a big deal, because as soon as someone opens the door, they're the first person you see, and most of the time they're going to come right to you. So you had, always have dealt with a very heavy load, and I thought you did that very well, and you were very, organized and able to kind of navigate your way through that, whether it was a really, really crazy day or just kind of a normal day. So I always admired that about you. I don't know if I would always want to have that seat myself, but
Thank you.
You did that very well.
Thank you. But I feel like I'm good at, so that's like my strong point. So I like that.
That's amazing because when you play to your strengths, you're going to have a better time doing what you do, and you're going to benefit your patients as well as your coworkers. I'm sure they appreciate that you do that as well.
Yeah, I feel it, yes, because if they see me doing it, then everybody else does it.
Right. Oh, that's great. So for you and the patient experience is very important. So what do you think you've done, or been able to partner with your company to do to improve patient experience over the years? Like any ideas that you had or things that you were able to work with, whether it was managers or doctors or, your coworkers, to just kind of improve the overall patient experience?
Well, like right now we're working on a project with entering, like as far as their annual and their recalls. Mm-hmm. We're putting working on a project doing all that, anything that wasn't entered, so that the patient doesn't not get a reminder in a year for their annual exam or any follow-up appointments that they needed.
Okay.
So,
that's important because you want to keep people coming back, and everyone gets busy. Sometimes they don't remember, so you want to have a good process to remind people.
Yeah, if you don't remind them, they don't come back for 2 years, 3 years, and they don't even realize that it's been that long.
Absolutely. So that's great. So let me ask you this. What was the hardest thing over time? Because I know at Brunswick Hills and other healthcare organizations that I've worked with, sometimes there's a major change, whether it's your electronic system, change of management, or anything corporate-wise. What was the biggest change that you had to navigate, and what did you do to get through that and not be discouraged by the transitions or the changes in your workflow and all of that?
Well, the transition, for the most part, was when we went to ECW, when we switched from I think it was I don't remember what we were working with, but we went into ECW. I don't even remember what the first one was.
Okay.
And we switched over to eClinical Works, and, there was a lot of problems when that switched over. So we wound up having to, keep the flow for the patients and not have them experience any of the problems. We just stayed with, paper charts if we had to, if the system went down. The patients usually never knew. We just worked it out, behind. They really didn't know. It didn't affect them at all. So that was, as long as they weren't affected and we were able to work it out.
Right, so you weren't really projecting whether it was a disorganization or your frustration or any complications weren't projected onto the patients, and you just...
Absolutely not. Absolutely not. No, we always took care of it without the patients having to even know what was going on. And
That's good. And, because those changes are difficult, and there's, even now when I speak to other people, in healthcare, there's people still going through these processes with the changing of their electronic medical records, and it's a big feat. Even if you're going from one electronic system to another, you have to make sure all the information is transferred and all the data is, it's a cumbersome project most of the time. And so having people on the front line that are, going to work with you and work with the practice and the patients to help, that's always very helpful. So now, what would you say is the best part of your job?
The best part of my job, I guess I love the people. I love being able to, make a difference to them and help them, and everybody in Brunswick Hills is pretty much the same as far as caring for the patient.
Right. So the culture of the people that you work with is very, very helpful.
Yes, everybody, right. Everybody, that's there pretty much just, they care about the patient. It's not that they're just there to do their job, or everybody works together as a team.
Absolutely.
For that amount of people to all work together well that way, it's pretty impressive.
Definitely.
So yes, as long as the patient comes in happy and goes out happy, and everything is taken care of the way it should be.
Yep. That's the goal, right? That's always the goal. And whenever you do ever work with people who aren't on that same page, it's very, it's hard to bring them in, into understanding that, if we work as a team, we're going to get way more done. We're always going to be on the same page. We're going to be happier, the patients are going to be happier, and we're going to get our work done. So that's extremely important.
But when everybody's doing the same thing, that's pretty much what, how it works.
Right. And as long as it's, in the best interest, and people feel that too, and patients feel that, and that's the information they share with their friends and their colleagues when, it's thinking about referrals and, having patients come back and introduce other people to the practice as well.
Yes.
So if you were not working in healthcare, what would you be doing?
That is a good question, because I do think of changing careers often, and I don't know what exactly it is that I would want to do. Okay. I would want to work with numbers. I like to work with numbers. I could sit at a calculator and just enter information all day long.
Okay. Wow. So maybe something with accounting or
billing, yes. Yes. I could sit on an account.
Okay. Now, does your current employer know that you have this skill?
No,
or that you
definitely not. Definitely not.
Well, it's always good to share. You never know what other opportunities may present themselves. You're funny. So how, let's see, what else do I want to talk about? When you have, so there's a lot of people who work in your office, and for my own experience it's a diverse group of people, diverse group of, age groups and all of that. Now, whenever a conflict or an issue arises that may be based on someone saying something, whether it's gossip or just, someone didn't approach the situation following whatever procedures are normal, how do you handle inter-office conflicts, things that are kind of behind the scenes, and what would you suggest for others, other receptionists who may be dealing with things like that or have dealt with it in the past? What would your path be to deal with that?
I do not get involved ever, and I would advise whoever it was, in the situation, just to, to keep it, keep it low, keep it quiet. If it's something that they need to get, above managers involved, do that. But especially at the front desk, there should never be any conflict or personal conversation or anything going on at the front desk at any given time.
Yes.
But it really,
happens, right? But sometimes it happens.
It does, and it has, yes. Never in my whole 8 years there have I seen it been a huge, I've never seen it to be a huge issue.
Right.
Anytime anybody was getting a little loud, I'd be like, guys, you got to take this, just go in the yellow room, we had this, yellow room. And I'm like, just go in the yellow room. But I've really never really seen it happen.
That's great. So let me tell you, so Cindy said, stay out of it, right? You want to not be involved in something that has nothing to do with you.
Well, I'm not going to get involved in any gossip. If you're going to ask me my opinion, I'm going to, take it as the situation comes. But no, I won't. Do not get involved in any of the gossip.
Absolutely, and I think that's great, and that's a wonderful word of advice. Keeping it quiet or involve management when necessary. Even if you overhear something or someone tells you something, it doesn't mean you have to join the conversation and become a part of it.
Absolutely.
And sometimes when people start to go down the path with you, you can easily say, I'm not interested. I don't want to be brought into this, and kind of exit yourself out of being, roped into any kind of conflicts or any negative kind of conversations.
It usually
and also
doesn't even get to that.
Right.
Because I don't engage in any course, so it usually doesn't even get to the point where I'll have to say, keep me out of it.
Right. And that's good. And other people need to know that too, because sometimes everyone doesn't realize how, a negative situation can kind of spread. And then it changes kind of the morale and just the feel of, we spend a lot of time in an office at work. You don't want to be surrounded by that. And I like the other thing you said as far as keeping calm or stepping away for a minute and coming back. That's always helpful, just to separate yourself from the moment or go have a conversation to diffuse things. So that's awesome. So my last question of advice would be, what advice would you give for a new employee who is joining a healthcare office or medical practice as a medical receptionist? What would your advice be to them?
Okay, so I just had this because I'm training someone that we've just hired about a week ago.
Okay.
And I don't, focus on you. Don't follow what anybody you see. If anybody's on their phones, we're not supposed to be on our phones, so you shouldn't be on your phone. We're not supposed to eat at the front desk. If you see anybody eating at the front desk, we're not supposed to, so don't, don't do it. Don't ever discuss your paycheck, your anything to do with, payroll with any other employee, because they will let you go in a second over something like that.
Right.
What else did I, just do what, do what you...
Yeah. Focus on learning what you need to do to be functional at your job, right?
Yeah, exactly.
Follow the rules of the office. Like you said, certain things like no eating, no phones, those are very similar across many different specialties and private practices, primary care physicians as well. Follow the procedures that are there for you, and don't, look at other people and say, oh, they're doing this, maybe I should do that. Keep your personal information as personal as possible, especially when you're just starting something. You should feel and understand, the lay of the land before you just kind of put it out all out there. Right. So I think that's great advice for new employees, and congratulations on. Yeah, exactly. But I'm happy to speak with you today. I'm so glad you've been with Brunswick Hills for 8 years. I had a wonderful time in my almost combined 10 and a half years with Brunswick Hills, and it was really important part of my career, and I know for so many other people it has been. So Cindy, thank you so much.
Thank you, Shivhon.
You're very welcome. And again, this is episode 6 of Medical Receptionist Network podcast. Today I'm going to send Cindy a free copy of the handbook for being such a wonderful guest. And I will be back next week. Oh, yeah, absolutely. We'll be back next week with episode 7. Thank you so much.
What a great show we had with Cindy today. I just wanted to follow up on one of the points that she made regarding speaking about salary with your coworkers and colleagues. Now, while it's not often looked upon as the best thing to do, and it's not always in your best interest, however, it's not something that would be the sole reason that someone would be let go in most cases, simply because it's not a law and it's not it's a rule that a lot of offices try to enforce. But if you do a little research on that, you will find that an employer cannot truly prevent you in most cases unless you are the person responsible for payroll, or you are aware of all the salaries in the facility if you have a management or business role there. However, it's not something that would keep you from keeping your job in most cases, like I said. However, please, when you think about that, I've always recommended against it. I've never done it in my own career just because it does cause issues. First of all, you never know where someone else started, and it's not. And I'm not going to go into unfair pay and things like that. However, if someone started at a job 10 years ago, the starting rate may have been different. So if they're going and they're receiving percentage increases over time, someone who started 2 years ago may have started higher, and that makes sense. And now some places will reevaluate overall and bring the company up to maybe a better living wage that works better for for their company and where their industry has gone. And the same with healthcare, but it's not always the case. And so when you're looking to discuss salary, usually it's because you're hoping for either an increase, or maybe you think that the wage is too low, or you're happy about what the wage actually is or the salary. But always do your research. We talk about that in the Medical Receptionist Handbook to Success is, do your own research. Find out what's standard. Find out what's average for your area, your specialty. Find out what the national average is. That way, at least if you were, given a fair rate to start, especially as a new employee and as a seasoned employee, there are other ways to go about looking into or requesting a salary increase if you believe that it's time for that for you. And so, I just wanted to piggyback on that. Generally, if someone is let go, and that might be part of the reason, but there's probably other reasons, or more valid reasons why someone would not be able to continue working for an employer other than simply discussing their salary with others. But like I said, you can look that up. You can type in, Google, and you can find different articles as well as different websites that have kind of laws and regulations regarding discussing salary at work, and you can get some clarification on that if you're not sure. So I just wanted to touch on that. And again, thank you. This is episode 6. Have a wonderful week.